How often do you come across a disease that affects only a handful of individuals worldwide? Pulmonary alveolar proteinosis, or PAP, is one such rarity. Imagine a condition where your lungs, the lifeline to your breath, start accumulating a substance called surfactant in their air sacs or alveoli. This buildup starts hampering the exchange of oxygen and carbon dioxide between your lungs and bloodstream. This is precisely what happens in pulmonary alveolar proteinosis. It's a rare disorder, often elusive and misunderstood, but its impact on those affected can be profound. And while it's a medical condition that's far from common, understanding it is crucial, not just for those who might be living with it, but also for all of us to broaden our knowledge of the myriad ways our bodies can surprise us. Let's delve deeper into the causes of this fascinating yet elusive medical condition. PAP isn't a one-size-fits-all disease. It comes in different forms, each with its unique triggers and patient demographics. Let's delve into these types and their origins. First up, we have primary PAP, also known as idiopathic PAP. It's the most common form and is believed to stem from an acquired defect in macrophage function. Macrophages are cells that usually clean up surfactant in our lungs, but in primary PAP, they fall short of their duties. Then, there's secondary PAP. This type is usually associated with various underlying conditions like hematologic malignancies or exposure to toxic substances. In other words, it's not a standalone disease, but a side effect of something else going on in the body. Finally, we have congenital PAP. This is a rare genetic form of the disease that typically shows up in early childhood. It's caused by mutations in certain genes that affect surfactant metabolism. Now let's talk numbers. The exact prevalence of PAP is hard to pin down, but it's estimated to affect about 0.1 to 0.23 cases per 100,000 individuals. It can strike at any age, but it's most commonly diagnosed in adults between the ages of 20 and 50. Next, we'll look at how PAP manifests in patients. Imagine struggling for breath, feeling fatigued, and experiencing unexplained weight loss. These could be the telltale signs of pulmonary alveolar proteinosis, or PAP. This rare lung disease manifests itself in a variety of ways, from mild respiratory symptoms to severe respiratory failure. Some individuals might notice a gradual shortness of breath, while others could be dealing with a persistent cough. Fatigue is another common symptom, which could be accompanied by weight loss. In some cases, patients might also experience chest pain and fever. The severity and progression of these symptoms can be influenced by the underlying cause of PAP. It's important to remember that while these symptoms may seem common and are present in many other conditions, in the context of PAP, they represent a significant impairment of the lung's gas exchange capabilities due to surfactant buildup in the alveoli. But how do doctors go about diagnosing this rare condition? Let's find out. Radiological imaging is the detective in our PAP investigation, revealing clues hidden deep within the lungs. When it comes to diagnosing pulmonary alveolar proteinosis, or PAP, high-resolution computed tomography, also known as HRCT, plays the lead role. It's like a high-tech magnifying glass, allowing doctors to see into the lung's tiniest nooks and crannies. Now, you might be wondering how exactly HRCT helps in diagnosing PAP. It's all about patterns. When a doctor looks at an HRCT scan of a patient suspected of having PAP, they're looking for a unique pattern known as crazy paving. Not your usual garden path, this pattern represents the alveoli, or small air sacs in the lungs, filled with proteinaceous material. Imagine a walkway made of irregularly shaped stones. That's what crazy paving looks like on an HRCT scan. But the clues don't stop at crazy paving. Other signs that doctors keep an eye out for include ground glass opacities, which are areas of increased attenuation in the lung, interlobular septal thickening, which is the thickening of the tissue walls between the lobules of the lungs, and consolidation, which is the filling of the lungs' air spaces with fluid. Piecing together these clues, doctors can confirm a diagnosis of PAP. And with the mystery solved, the path is clear to move onto the next stage of the PAP journey. After diagnosis, the next step is treatment. What options are available? Let's explore. The goal of PAP treatment is clear: removing the surplus surfactant from the alveoli. This is primarily achieved through a technique called whole lung lavage. considered the gold standard treatment for PAP. Picture this as a thorough spring cleaning for your lungs, where they are repeatedly washed with a saline solution, flushing out the excess surfactant. This procedure can significantly improve lung function and alleviate the symptoms for many patients. However, it's not a one-time solution. Depending on the severity of the disease, multiple lavage procedures might be needed over time. Now let's talk about some of the emerging treatment modalities. In recent years, we've seen the use of granulocyte macrophage colony-stimulating factor, or GM-CSF, either inhaled or given subcutaneously. This innovative therapy stimulates macrophage function, enhancing the body's natural ability to clear surfactant. For severe cases that do not respond to other treatments, lung transplantation may be considered. This is a major surgical procedure that replaces the diseased lungs with healthy ones. It's certainly not the first line of treatment, but it provides hope for those with severe PAP. Remember, early diagnosis and appropriate management can make a world of difference in improving outcomes for patients with PAP. And there we have it, a comprehensive review of pulmonary alveolar proteinosis. We've journeyed through the intricate landscape of PAP, a disease as rare as it is complex. We've delved into its origins, from primary to secondary and congenital forms. We've understood how it manifests, with symptoms ranging from mild to severe respiratory distress. We've seen the vital role of radiology in diagnosing PAP and the critical importance of whole lung lavage in treating it. We've also explored emerging therapies like GM-CSF and lung transplantation. Remember, early diagnosis and appropriate management are crucial in tackling PAP. Stay informed, stay healthy.